Hi everyone, let's walk through an NCLEX practice question that might be similar to something that you could see on your exam. A registered nurse is planning a health promotion program for the community. Which of the following activities is a form of primary prevention? Is it 1, administering flu vaccinations, 2, assisting stroke clients in relearning how to walk, 3, conducting blood pressure screenings, or 4, providing specialized wound care to clients suffering from long-term diabetic wounds? Before we tackle this one, I want to give you a helpful memory trick. When I think about the levels of prevention, I think we have primary, then we have secondary, then we have tertiary. So I like to look at the first letter of those 3 words to help me remember what they stand for. So primary, you can think P for prevention. Secondary, you can think of that S as standing for screening. Tertiary, you can think of the T as standing for treatment. So now let's look at our answer choices, okay? Number 1, administering flu vaccinations. Students often get confused between primary and secondary with this one, so let's leave this one alone. We will come back to it. Number 2, assisting stroke clients in relearning how to walk. So what do you think about this one? You got it, tertiary, because they've already had the stroke and now we are assisting them in relearning how to walk. And like we said, tertiary equals treatment. So we're helping them kind of manage a condition that they have already had. Now, number 3, conducting blood pressure screenings. Well, this one should be a giveaway because remember what we said, secondary equals screenings. Think of those S's, okay? So that is going to be a form of secondary prevention. And then number 4, providing specialized wound care to clients suffering from long-term diabetic wounds. Well, that one's kind of similar to number 2 because the client already has the diabetes. They already have had these diabetic wounds. So you can think of that as a form of tertiary or treatment. Now, the answer is number 1, if you guessed it. So I like to think here, administering flu vaccinations is a form of primary prevention because it's aiming to prevent disease or injury before it occurs. So if you guessed that one, you would be absolutely correct. Great job. We will see y'all back next time.